following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, asthma and allergies. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. More than 20 million Americans have asthma. About half of them have allergic asthma. Airway obstruction and inflammation leads to coughing, wheezing, shortness of breath, and chest tightness. Its triggers are common substances such as dust mites, pet dander, pollen, and mold. How do you know what triggers your asthma attack? What can you do to prevent allergies? How do you treat asthma and allergies? We'll get answers to those questions and more tonight from our two guests, Dr. Giovanni Piedemonte, the Chair of Pediatrics at WVU and an asthma specialist, and Dr. Yesham Demirda, a pediatric allergist at WVU. If you'd like to ask our guests a question, give us a call. Our phone lines are now open. Giovanni, we'll start with you. There are two types of asthma.
Yes, usually we make a distinction between allergic asthma and non-allergic asthma. And the allergic one is triggered by allergens, by substances that don't produce any problem in a non-allergic individual, but only in sensitized individuals. Instead, the other one that does not have an allergic component. And in children, which is the primary population we serve, the first 2 years, generally speaking, the episodes of wheezing, which is the most important symptom of asthma, in the first 2 years, those are usually episodes that are almost always triggered by viruses. The older the child, the more we see a more important allergic component. And we also observe that the children that are triggered only by viruses early in life tend to grow out of the problem. Instead, the ones that are specifically allergic to something continue into adulthood.
And is there a general estimate of how many children have asthma?
Well, we estimate that in the United States, the latest estimates, and you have to understand that all the epidemiologic estimates are always at least a couple of years behind the actual date. But we estimate that there are more than 20 million asthmatics diagnosed in the United States, and we estimate that between 5 and 6 million of those are children in pediatric age, up to 18.
It's a lot of children, and certainly some of them will also have an allergic component, and it's allergy season now. What can our viewers expect from allergens this time of the season?
Currently, we have some grass pollens and mostly wheat pollens out there. Those can cause seasonal allergic rhinitis, sometimes seasonal exacerbations of asthma as well. In terms of indoor allergens, the most common ones are dust mites. Dust mites are tiny little bugs. They like to live in a mattress, in pillow, and then in the box spring. And also on the carpet, they love to hide in the carpet around the bed. And the droppings of these dust mites can cause allergic reactions, mostly allergic rhinitis and asthma. In some patients, in sensitized patients, can cause eczema as well. And other indoor allergens are pets. They are, although they are a part of the family, still they may cause allergies, especially cat dander, dog dander. They can cause perennial symptoms in sensitive or genetically sensitized individuals.
I think we may have put a picture of a dust mite up there for our viewers to take a look at. And,
Yes.
and I know that food also plays a component in allergies. And
Yes.
okay, the dust mite picture is up now.
Yes, we cannot see the dust mites, but they are so small, they live in there, and then it's very hard to eliminate them. The best way to reduce the exposure to dust mites is just to cover with appropriate covers the mattresses, box spring, and a pillow.
To give us an idea of the size of them, how many would fit on, say, a eraser?
Probably 5 to 10 microns, so tiny,
So
tiny.
microns are very, very tiny, very tiny measurement.
1,000th of 1 millimeter, I guess. Yeah.
Very good. Well, we have our first caller tonight. We have Pam from Monongalia County. Pam, welcome to Doctors on Call. What's your question?
I recently have been diagnosed with all kinds of allergies, even at the age of 32, of things that I've had all my life. And I was just wondering what would have caused this so late in life and why.
Okay, so Pam has a great question. Her allergies started later in life.
That's a very good question. Allergies can start any time of the life. If you have genetic background, it can start any time. Every individual has different thresholds. So even age 70, 75, you can still have developed allergies to anything. So you didn't do anything wrong. It was just in your genes and some environmental factors. You need to see an allergist and know your allergens, what triggers, and try to reduce the exposure.
Okay, so there's a genetic component to allergies. Is there a genetic component to asthma? Do we pass that along to our children?
There is definitely a genetic component, but it's not as simple as in other types of disease. There are certain diseases, for example, cystic fibrosis, in which there is only one gene that is involved. Asthma, like diabetes, like other chronic diseases, is generated by a constellation of genes. There are multiple genes, probably dozens of genes that contribute. And those are types of diseases in which you always have a genetic component and an environmental component. So you can be born with the genes and yet never or very rarely have symptoms of disease because there is not the environmental trigger. And so you need to have both at the same time, same place, same individual. And when these two elements connect, the genetic predisposition and that specific trigger, then you develop. And that may happen, as Dr. Demedag mentioned, can happen late in life. Okay. The majority at least give some manifestations in early age. But a lot of times, basically, this can happen at any age.
Now, you've done a lot of research on pollution in asthma. Those are the type of environmental triggers you're talking about, pollution as well?
Well, our research actually has concentrated on environmental pollution generated by traffic, by automobiles. And we found that we recently published a paper that is one of the very first that shows that it's enough that you take children that are asthmatic in an urban area with high pollution, and you move them for just 1 week in a second area where the pollution is much lower, and that their allergic symptoms decrease, their eosinophils, the allergic cells go down in their nasal secretions, actually disappear, their pulmonary function improves, and they just feel better. So this is a very important aspect. She mentioned that there are two different types of environmental triggers. The external ones, so for example, the environmental pollution and the things that you have in your house, like, for example, the dust mites. We emphasize that it is very important to pay attention to the environmental pollution in the outside environment, because that can make a big difference in asthmatic children.
Excellent. Well, we have our next caller. We have Linda from Monongalia County. Linda, welcome to Doctors on Call.
Thank you.
Do you have a question?
Yes, I've had a cough, and I can't seem to find out what's wrong with it, what's causing it.
What's your age?
60.
60? Well, I think it's very, very important that you see, first of all, your primary physician, and also, if possible, a pulmonologist, because there are several dozens of possibilities that can trigger that cough. It is possible, for example, that you have a sinusitis and you have postnasal dripping and that makes you cough. It is possible that you have gastroesophageal reflux and when the gastric acid comes up, that makes you cough. Is it quite possible that you have an infection that was not treated or only partially treated and that can make you cough? It is possible that, are you a smoker? She's gone. If you smoke, of course, that is the main predisposition to what we call COPD, chronic obstructive pulmonary disease. By the way, West Virginia is number one in the country for per capita cases of COPD. So the possible causes, pulmonary and extrapulmonary, so things that happen in your lungs or things that happen outside of your lungs that can make you cough are extremely various. But the three most common causes are gastroesophageal reflux, sinusitis, and asthma, because asthma not only manifests as wheezing, but in many individuals just manifests as cough, usually dry cough, triggered by a variety of triggers, but asthma can simply be simple cough with no wheezing.
Okay. So asthma has wheezing and cough. Let's get to some of the symptoms that our viewers may see with allergies.
Allergies can present in different symptoms. The most common symptom to food allergens, for example, skin symptoms such as hives, or in some kids, eczema can be a presentation of food allergies. Also, patients can present with nasal symptoms or eye symptoms such as itchy eyes, watery eyes, sneezing a lot, itchy nose, congestion, stuffy nose, and also chest symptoms, coughing, wheezing, chest tightness, short of breath. Those can be the symptoms, and this can happen all together or separately.
Okay. So there's some crossover there, and we certainly will get into treatment. But we have another caller from Tyler County. This is Judy from Tyler County. Good evening, Judy.
Good evening. How are you?
I'm great. Can we have your question, please?
Yeah, my husband has asthma and allergies, and he's 47 years old. And we've been to 3 different ear, nose, and throat doctors with him, and he's been having trouble with his sinuses, and he's had 2 sinus surgeries over the past 2 years. And he's having trouble with his ears bulging out on the inside, they said the other day. And we were wondering, and one doctor diagnosed him with Meniere's disease. And we just was wondering if his allergies could be causing a lot of his problems now.
Okay.
And he said he was having, like, blurry vision, too.
Okay.
Meniere disease is much more common in women and usually manifests with dizziness, paroxysmal dizziness. So Meniere is not really a direct cause of coughing or asthma. I will say that if your husband was seen already by multiple ENTs, one of the critical aspects of diagnosis is to measure his pulmonary function. So I think he should, as soon as possible, be seen by a pulmonologist or an allergist, or somebody can perform what we call pulmonary function test, which is a very simple test. It involves basically just blowing into a machine. And that, per se, gives us an enormous amount of information, because it tells us, first of all, if the windpipe is constricted, is smaller. Tells us if that can be reversed using drugs like a beta agonist. So allows in many cases to make a direct diagnosis of asthma or to rule out asthma, because unfortunately not all the causes of wheezing and cough are asthma.
Sure.
And that is the most challenging aspect. That you need to have somebody, possibly a pulmonologist or an allergist, that defines whether his lungs are working fine and what type of condition is the cause of the symptoms.
Sure. So they've looked at the ears, nose, and throat, and now it's time to take a look at their lungs as well. Okay, we now have Barbara from Monongalia County. Barbara, welcome to Doctors on Call. You have a question?
Yes, I do. Thank you. I was wondering if you could help me to find out what I could put on my eye or put in my eye or take from my eye, because I have a lot of puffiness. And they're irritated a lot, so I'll scratch them, and then I have these dark puffy circles, and it just drives me crazy. So I just really need some advice and some help on how to treat them better.
And this is from allergies. Are they seasonal allergies, or?
It seems to happen year-round.
Okay. And are you on any medications?
No.
Okay, great. So puffy
Yes,
eyes.
this is a very good question. Puffy eyes can be caused by many factors. It can be an allergy to the environmental allergens such as pollens or dust mites, just presents with only ocular symptoms. It can also be due to some contact dermatitis, such as some cosmetics put on the eyes. So she should be seen by an allergist, definitely, and allergy test should be done in order to rule out or rule in allergies. If there is no allergies, probably she needs to see an ophthalmologist as well.
Okay, so she's looking at both allergies and
Yes.
ophthalmology as a possibility.
Yes.
So if it was allergic allergies, what sort of medications would you recommend?
Yes, we can use topical antihistamines. There are a couple of them, eye drops, topical. Also, some eye drops also contain some decongestant, which will reduce the symptoms. Also, if the symptoms don't resolve with these medications, we can always, anytime, if there's allergy in the background, we can always start allergy shots and see how she does.
Well, we'll certainly get to asthma treatment as well, but let's ask a quick question. Who needs allergy shots? Who should have testing?
Well, first of all, insect sting allergies. They are
So bee stings.
Yes, bee stings, honeybee, wasps. In the south, there are fire ants. Those allergies respond very well to allergy shots. Second, allergic rhinitis, which is also called hay fever, like seasonal allergic rhinitis. If the patient symptoms don't improve with medical management, with the medications and reducing the exposure, we should go ahead and start allergy shots. Allergy shots is a very long-term commitment. The patient should come to the office initially once a week. Then we will give the shots once a month, at least for 3 years. So it's a long-term commitment, so we need to pick the patients very, very carefully. Okay. Also, asthma patients can also respond to allergy shots.
Great. Well, we have our next caller is Lisa from Wetzel County. Lisa, good evening. Welcome to Doctors on Call.
Hi, good evening. I was wondering, could you give me some input on this? Every time that I am around, like ink, toilet paper, I start coughing like I'm choking to death. And sometimes, just out of no reason, I will cough real bad and can't get my breath. And also, I was wondering, how do you determine that you have asthma?
Okay, did you say ink?
Yes,
ink.
Toilet paper.
Okay.
Ink is in writing.
Is this related to your job or?
No,
Okay.
every day,
Okay, so.
Well, certainly you need to have a basic workup, and again, the usual. First of all, it's very critical to come up with the accurate history, and the triggers and when you start coughing and so forth. All those historical information is very important. Then it's important to do a physical exam on you, of course, by a physician that determines whether the sounds coming from your lungs are normal or not. And then basically the first test that again you will benefit from is a pulmonary function test. We have machines that are extremely simple and extremely accurate now, even portable ones that allow us to measure how much air comes out from your lungs and define whether your lungs are working fine or not. And if necessary, we have even more sophisticated machine that allow us to get any type of information from the lungs. Another thing that may be indicated at that point is to do a chest X-ray. If something doesn't look like everything is normal, the chest X-ray gives us the information about the structures of the lung. And after that, for example, I will probably send you to my colleague, Dr. Demerdag, who will be able to do a full panel of allergy testing. Yes. And possibly in one single visit, you could have the entire information about how your lungs are working, what is causing your cough, whether or not you have allergies, what type of allergies you have, what type of asthma, if you have asthma. And this in many centers requires basically just a single visit.
Yes.
Okay.
And also, asthma symptoms can be triggered not only by the allergens, but also by the irritants like tobacco smoke, strong perfumes, strong smells, such as ink smell. I think it's strong enough can produce symptoms. So she should definitely avoid exposure to. I don't know how she's going to do with toilet paper.
That's true.
Yeah.
So Lisa, you should start with your primary care physician to look into that. We have Judy from Lincoln County on the line. Judy, welcome to Doctors on Call.
Thank you.
Do you have a question?
Yes, I need to know the difference between asthma and bronchial asthma.
What's the difference between asthma and bronchial asthma? Judy's asking.
Well, the truth is there is no difference. Asthma is a condition that affects the bronchi. So we call, most people call it either way, asthma or bronchial asthma. In general, that makes it look different from another condition that is called bronchiolitis that affects the smaller windpipe, the very small airways. Asthma usually affects the central airway, so the larger bronchi, the ones that are the closer to the mouth, pretty much. So in truth, it's very difficult to put the physicians in a room and make them agree on terminology. So like in many other diseases, there are many different ways of calling the same thing, which at the end of the day is asthma.
It's the same. Okay. Well, let's talk about treatment for asthma. We haven't had a chance to touch on that topic. Anything new?
Well, the categories remain primarily two. We have drugs that we call rescue medications and drugs that we call maintenance medications. The rescue medications and the primary ones are the so-called beta agonists, the short-acting beta agonists, are what we use on an as-needed basis when somebody is having an acute attack.
That would be albuterol.
Albuterol. There are some other forms, but the albuterol is worldwide is the most common. The other medications are generally anti-inflammatory medications because they have to deal with the inflammatory component that is critical for the persistence of the narrowing of the airway. And the most important of those medications are inhaled corticosteroids, and there are several types, and there are some that are relatively new. Now we also have long-acting beta agonists that open the airways by relaxing the smooth muscle, and these particular beta agonists are able to last for about 12 hours, so you can take it twice a day. And those are the most important one. In the past, we were using theophylline. Today, we don't use theophylline pretty much anymore. Intal and other medications called Cromons, very rarely used. Another type of medication that is quite commonly used, both for allergy and for asthma, are the anti-leukotriene agents. And there are at least two on the market in the United States.
Which two? What are the names?
The commercial names, or the one is Singular, and the other one is Accolade. And what they do is they block an inflammatory mediator that is very important in asthma and is important in allergies, so they have a double effect on allergies and asthma.
Okay, so a lot of crossover there. I think it's kind of important to tell our viewers that when you have an acute asthma attack, though, those other medications, your second line of medications, probably aren't going to help you at the time of your attack?
That is very true, because those are maintenance medications. Those are medications that you have to use continuously for a longer period of time. For example, an inhaled corticosteroid, usually, in order to have a maximal effect, sometimes you have to take it for 2 to 3 weeks, sometimes even more than that. So unfortunately, we have patients coming to clinic and say, look, I'm not getting any better, and I'm using this as needed. Well, that's not the way to use that particular medication. So it's very important, the education component. Nobody should leave the office of a physician without having not only the information of what medication they're going to use, but also how to take the medication, because in asthma there are a lot of inhaled medications and they require some coordination and they require sometimes some additional devices. And without knowing when to take that medication and then follow religiously those indications, because I will say that the most common cause of failure of management of this type of conditions is either non-compliance, people that, they just think they don't need the medications and they get sick and sick and sick, or the people that take the medications, they want to take the medications, but they don't have the necessary information. They make some mistake in taking it, using the inhalers and stuff like that.
Yeah, so when you're feeling good, and your allergies aren't bothering you and your asthma isn't bothering you, it's still important to take your medicines, your asthma medications, and to have your allergy shots.
Definitely.
And that will also decrease when you do have a flare-up, those issues?
That is correct. The idea, what we want to achieve is prevent. Because once the asthma attack starts, it's much, much more difficult to block. Okay. And may take you to the hospital, and you're going to be miserable for several days. The idea is that if you use small amounts of medication, longer period of time, you're going to be preventing.
Very good. Excellent. Well, we've had great questions and comments from our viewers. We've been talking about asthma and allergies with Dr. Giovanni Piedamonte and Dr. Yesham Demirdag. Thank you both for being with us. If you'd like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good health.
Join us again next week for another edition of Doctors on Call. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.